all been extraordinary.
Millions of people are transforming their bodies with GLP-1 treatments. But there's a side of that journey that almost nobody talks about, but today we are. Welcome to Owning Extraordinary. I'm Karine, and this podcast exists to give you real, honest, and nuanced conversations about medical aesthetics and what it means to feel at home in your own skin. Today's topic is one that's been on a lot of people's minds. What happens to your skin after significant weight loss from a GLP-1 medication? Loose skin is a real part of many people's journeys, and it deserves a serious, compassionate conversation. And to talk about that today, I have a guest who's redefining what it means to practice medical aesthetics, not just as an art, but as a science rooted in deep research, a holistic approach, and genuine human connection. And I can say that because I'm one of her patients. Dr. Kassandra Oliva is a general practitioner based in Montreal and trained at the Université de Montréal. Since 2020, she's been collaborating with Dr. Nicholas at Victoria Park's Clinical Research Center, where she's at the forefront of evaluating cutting-edge technologies and developing innovative protocols in the field. She also completed advanced training in Beverly Hills under Dr. Christopher Kassandra, diving deep into the clinical application of bioidentical hormone therapy and metabolic health. She now integrates that expertise into a holistic practice that connects hormonal health, regenerative medicine, and aesthetics to optimize skin quality, body composition, and overall well-being. For Dr. Oliva, beauty isn't about perfection. It's about balance. It's about confidence. It's about honoring what makes each patient both whole and unique. Please welcome Dr. Kassandra Oliva. Thank you for being here.
Thank you for having me. It's really a pleasure.
Such an important conversation that we're going to have today. And as I mentioned in the intro, as a patient of yours, what really does set you apart is that holistic approach. So when you have, a middle-aged woman in front of you in your office, you really do address all of the aspects of her entire health. And you do a ton of research on trends, on what's happening, on developments. And one of those trends is definitely medically driven weight loss and the impact of that rapid weight loss on aesthetics. So what led you to personally have an interest in this emerging trend?
So what led me to have an interest is in my practice, I tend to address the patients as a whole, as you've mentioned. And I've noticed that, even though we are an aesthetic clinic, our patients come to us often not just for an aesthetic purpose. They usually come to us in times of need, in times of transformation, and times of transitions in their life. So I started seeing more and more patients going through that transition of going through a weight loss journey and needed support in terms of the side effects that they were experiencing after that weight loss journey. And so that piqued my interest, and addressing it holistically with hormonal changes, with the aging process. I think that, that's the only way we can really give a complete treatment plan to our patients.
So speaking of, you're saying that you're seeing more and more of those patients come in. Now we know that GLP-1s have been around for a few years, but they've really seen a rise in the past couple of years, would you say?
Yes.
So what are the changes that you're seeing from your patients on this front specifically?
Like I said, the changes that I'm seeing is now I feel like a lot of people were hesitant at the beginning in taking the medication.
Yeah.
People are becoming more and more open to taking that medication, not only for the prescribed indications, but also, for weight loss or even aesthetic weight loss. And they they go through that transformation and they're so focused on weight loss and they don't necessarily pay attention to, the side effects of that weight loss.
Yeah.
And all of a sudden they wake up one morning, they look at themselves in the mirror and they don't recognize who they're seeing anymore.
Yeah.
And even though they feel healthier and they feel better from a metabolic stand of view, when they look at themselves, they see extra skin, they see crepey skin, they look tired, even though they feel better. And so now they're reaching out to have help in that domain, and they're they're wondering like, what can I do different? Like if I want to continue on this journey, right?
Yeah. Yeah. In your experience, what's often most misunderstood about these transformation journeys that we're seeing?
I think what's misunderstood is they tend to see this journey in steps, right? Stepwise fashion. They often want to just focus on the weight loss without addressing the whole.
Yeah.
And so they start taking this medication and they don't necessarily always have the right support in terms of, having a balanced nutrition, integrating exercise, right? We want to maintain muscle mass. And so they kind of often do it in a way that's unsupervised without the proper medical support. And then, at some point in time, they realize, like I should have maybe approached it a little bit differently. I shouldn't have been scared to, do aesthetic procedures to help
advance.
me. Yeah, in advance, right? I think a lot of people are like, I'm going to lose all the weight and then I'll see what I'll do, right? To try and address. But the truth is that the best results happen when you start preventing, right? You start at the very beginning of your journey, by eating properly, by exercising, by doing some, procedures that will help with your skin health.
Yeah.
So, because at the end of the day, there's only so much we can do after you've lost all that weight if we haven't addressed
set it up for success.
Exactly.
Okay, so let's dig into that. I think that's such an important insight for our audience to know. What you said about starting a GLP-1 and then just waiting for those results versus doing all of the things, whether it's nutrition, whether it's muscle building, whether it's skin health or skin laxity, in conjunction or even in advance of your GLP-1. And I think most people don't know exactly what that is because there's so much stuff in the media about just taking the GLP-1 and potentially even some side effects like nausea and muscle loss. But there's really not a lot, which is why we wanted to do this podcast. There's really not a lot about how to support your GLP-1 journey from a medical aesthetic. So let's dig into it. So we know that one of the major symptoms of rapid weight loss, which makes sense, you have that after pregnancy in terms of the belly. Like if you lose a lot of weight very, very fast, your skin can't bounce back as quickly. So is that what happens with our skin after weight loss?
So yes, in essence, that is what happens, right? So basically, people think about weight loss and they think about fat just as volume, but fat also contributes to structure, right? It's pushing your skin up. And so I usually give the analogy to my patients where it's as if you have this this fabric stretched out over a structure and all of a sudden the structure under it collapses or changes.
Yeah.
The fabric doesn't have time to kind of like retract and, go back to where it should be, right?
Exactly.
So obviously, if you need to pace yourself in your weight loss journey. From a medical standpoint, it's not healthy to lose too much weight too fast, but also aesthetically, you're putting the chances on your side. If you pace yourself in your weight loss journey, you're giving time for your skin to be able to retract a little bit. You're also, trying to do all of the lifestyle changes that should accompany the GLP-1 usage. I like to sit down with my patients if we go on this journey together, and I speak to them frankly about not just their medical history, not just their background, but also their lifestyle habits. Right? What's your nutrition looking like now? What's your exercise regime looking like now? Your sleep. Why are you having these patterns of eating? Right? Because there's a deeper root to this. And so we look at it together, and I make sure that we have the conversation that this is a tool, right, to support you in this journey. But we also need to make lifestyle modifications, not only to make sure that you have success in this weight loss journey, but also to make sure that we are putting all of the chances on our side from an aesthetic point of view, right? If you're eating well, if you're hydrating,
it'll show.
It'll show in your skin, right? It'll show on how you'll bounce back. And that's extremely important. That's the foundation of everything, because we can, offer all kinds of treatments, but if they don't have the basics, there's only so much we can do, right? So I like to dig in deep and help them establish these new lifestyle habits as well.
Yeah, I'm going to take a bit of a psychological twist to just the specific part of the conversation is I feel like when people want to lose weight, all they think about is losing weight. And correct me if I'm wrong. Do you need to convince them to look at the holistic picture? I feel like, we're so weight obsessed in this society that I feel like the focus would simply be on fat loss. Is it a difficult conversation to convince them that it's not just about that weight loss?
Yes. Well, I think once we have the conversation, they eventually understand the vision that we have, right? Because at the end of the day, we're doing this for their long-term health.
Yeah.
I think that what drew me into, this GLP-1 journey and creating, right, a program is that I feel like that's where longevity and medical aesthetics collide, right? It's about, really bringing all of this together. We can't just treat longevity or treat aesthetics separately anymore, right? So I try to integrate that in that talk. When we sit down, we have that conversation. I say, I know you really want to lose this weight, but let's look at this from a long-term point of view.
Yeah.
My goal here is to accompany you and make sure that you don't create other issues, right? In the long term. Your health is number one. We're doing this, yes, because you want to feel better in your skin, but also because, GLP-1s are associated to many health benefits, right? And give you better metabolic health. And I don't want to be creating another issue because you're losing muscle mass. And in the long run, I'm setting you up for failure. Right. And so I really try to ground the patients and have a discussion. And I mean, at the end of the day, once we talk things through, I think it becomes evident to them. But it's normal. If nobody talks about, those aspects, how are they supposed to know? So when we have an evaluation, I don't just look at the weight on the scale. I look at their muscle mass percentage, their fat percentage. I try to move away from just the weight on the scale.
Where they are hormonally.
Exactly. That's part of the conversation. Are you, as a woman, are you menopausal? Are you perimenopausal? It has an impact on, how you're going to feel, how you're going to lose the weight. Obviously, it's extremely important.
Yeah. We need more people like you talking about it. So let's talk about back to the loose skin. As you mentioned, there are lots of different consequences or repercussions to GLP-1. The one that we're, most interested in from an aesthetic perspective would be loose skin. Are there specific factors that make somebody more at risk than somebody else, such as how quickly someone loses that weight, or even, some people have thinner skin than others?
Absolutely. And that comes into the equation, right? When we sit down and we have a plan for a weight loss program and an aesthetic program to help them, we target all of these things, right? I ask them, and there are many factors that come into play, such as age. Obviously, we don't like to talk about it, but clearly that makes a difference. Your hormonal status, so whether you're premenopause, postmenopause.
And that'll impact how loose your skin is going to be?
Well, yes, because we know that in the postmenopausal stage, once you are fully menopaused, and if you don't take hormone replacement therapy, you will lose up to 30% of your collagen within the first 5 years, right? So if a patient comes to me in that stage of life, of course, my approach is going to differ, and I'm going to try and, increase the stimulation of collagen because her reserve is low, right? Her reserve is low.
That's so interesting.
To address that.
And
she is more likely to have more laxity, more loose skin if she goes on a GLP-1. So we tailor the approach to the individual, right? We don't have a set program. If a patient is menopausal, then, I will probably want the weight loss to be less quick, right? We want
gradual.
It to be more gradual. We want to moderate the weight loss. We want to try and integrate biostimulation to stimulate collagen early on at the very beginning of the journey to prevent that, right? I also address nutrition. I'm not a nutritionist, but I do give, basic guidelines, such as protein intake, such as hydration, eating full of antioxidants. But and I refer them if I need to a nutritionist because it's extremely important. It's extremely important.
What do you wish people understood more about this topic that they don't?
In the patient that's wanting to lose a lot of weight, they have this misconception that if they do aesthetic procedures while they're on this weight loss journey, they won't see the results of all their hard work, right? They're trying to lose weight. And at the beginning, when they start losing volume in their face and losing structure, because fat also offers structure in your face, they're happy, right? Because it's kind of like the reflection of all their hard work. So they're scared often to resort to aesthetic procedures such as injections of filler or biostimulation because they don't want to look filled.
And they're getting all the compliments.
Right? Exactly. There is a way, if you are supported throughout your journey, where we can, do aesthetic procedures that will just give you back that structure without adding volume. Right? It'll just make you look like the best version of yourself, less tired, less, make you look healthy because actually you're healthier, right? Throughout this process. But sometimes that's not really being reflected in your face because of that weight loss, because fat is something that is not just creating volume. It's also, giving you structure to your face.
Yeah. And if you look at, a little kid, they've got the chipmunk cheeks, youth means plump as well. And also, if you think of it, when something is more plump, you see fewer wrinkles and fewer, folds that are not as deep. So I could see, and I think it's such an important nuance what you said about volume versus
structure.
Volume could be scary for somebody who is on a weight loss journey, but structure or skin, bounciness.
Elasticity. Exactly.
That's the medical term, ladies and gentlemen. Elasticity is very different. And I'm sure that when you position it like that to your patients, it's a lot less scary for them.
It is, absolutely. But it's a discussion we need to have.
Yeah.
Right?
Yeah.
And I think that's the difference when we offer, this program to our patients. We do address it and we talk them through it. But a lot of patients are, taking this medication, not always under
medical supervision.
Exactly. And so from 1 month to the next, sometimes things can change drastically. And often in clinic, I need to switch gears with my patients. I'll, slow it down if I need to. But if patients are not
being supervised,
right, then they only figure it out a few months later because let's not forget, we see ourselves every day. We don't see the changes that are occurring every day. So before they really realize what's going on in front of them, it
can be too late.
Yeah. Exactly.
Well, that was my next question is there a point where it is too late, where you can't, where you have lost too much weight or your skin is too loose? Is there a point where there's a point of no return?
Well, it depends on whether the patient is open to surgery because then it becomes a surgical case, right? I think if we address it along the way, we have a lot of treatment modalities that we offer that can support the patient and maybe avoid having surgery. Sometimes there are weight losses that are too drastic that inevitably you're going to need surgery. But I think that overall, most patients can really benefit from addressing their skin concerns early on because we know there's an array of techniques that we can use to help with skin health.
And actually, I was in my research for this podcast. I don't know if this is going to happen in Canada, but Lilly, the pharmaceutical company, I read that is developing a weight loss medication that you can lose up to 30% of your body fat. So if that comes to Canada, in that case, doing those preventative measures will become even more important, because today on, say, an Ozempic or Mounjaro, how much weight does one typically lose?
Again, it's not set because everybody's different and there's many factors that come into play. But overall, it's about what's feasible in a certain amount of time for a patient, right? Like, I think overall, in the long run, you can lose quite a bit of weight if you introduce lifestyle habits as well, and you change your lifestyle, then you can be on it for quite some time and lose up to 100 pounds if you need to. But most patients don't necessarily need that. In our field, I think we offer more of an aesthetic weight loss. We're not really dealing with patients with comorbidities. So I can only speak for our practice, where usually the average amount of weight being lost is maybe under 30 pounds. But, it really varies from one patient to the other.
Yeah. And I mean, that would still have massive changes to
absolutely
to your facial structure. Would loose skin at some point naturally bounce back? Earlier, your analogy of that fabric, if you let it be, would it eventually tighten up?
There's a limit, right? Like it might tighten up a little bit eventually, but it'll never go back to how it was originally if the weight loss was too rapid. We want to make sure that the patient loses that weight in a moderate way. And so there is an amount of weight that you're going to lose that prevents you from not having any loose skin at all, right?
Yeah.
At some point in time, if you take the example of 30 pounds, that takes up a lot of space.
Yeah.
So we can definitely reduce the amount of laxity, but we can't take it away completely.
Yeah.
And that's a conversation we have to have with our patients.
Right.
They have to, be realistic about the expectations as well, right? And that's where at a certain point in time, when the amount of weight to be lost is too great, then, they need to see either their family doctor, because usually there's other comorbidities that are related, and possibly eventually see a surgeon if they want to remove that skin, right?
Yeah. And conversely, so if I take the other extreme, not extreme, but the other side of that is, I think in my circle of friends, I think, people want to lose between, say, 7 and 10 pounds. Would you still need that holistic approach? Would you still need?
Definitely. Yeah. Absolutely.
Even with a smaller weight loss?
Absolutely. Absolutely. I think that once you get around to the 10-pound mark as a general, number, especially depending on your stage of life, we definitely want to take a holistic approach. And I think that that's probably when we get the best results, in the sense that, a lot of the patients that come and see me are also patients that are doing absolutely everything right? They're, working out, they're eating well in a balanced way, because nobody should be obsessed about what they're eating, right? And depending on their hormonal status or, what's going on in their life, they just can't lose that last 10 pounds. Right. And so this does help them. And it just helps them go through that last weight loss that they need to achieve. And it also, what a lot of patients report is, it helps the relationship with food at the end of the day, right? It's you start realizing that there's patterns that maybe you weren't seeing anymore.
Right.
And so if it kind of creates that distance so that they can introspect, and then it helps them after we finish the program, or it helps them in the long term as well.
Yeah. Yeah. Would you recommend that a, say, 45-year-old woman who has, say, 10 pounds to lose be on hormones and GLP-1 at the same time? Is that?
I'm going to say that I can't do a blanket statement, but it is often a good part of my patient population, actually, right?
Because don't hormones, to a certain extent, make you gain a little bit of weight? So are you like using one to counterbalance the other?
Some of the hormones can create a bit of water retention, and it can cause a little bit of weight gain. That's what's reported by patients. And so, yes, by using a GLP-1, often patients can counteract that a little bit. But often, unless there is a medical indication to continue using GLP-1, then we use it for a short amount of time to help these patients, feel better and create new healthy lifestyle habits. Because often when we dig a little bit deeper, we also see that, okay, like we can, help you with cravings and doing more weightlifting exercise. That's so important in the postmenopausal population, right? So it kind of becomes like a driving force for certain changes in their life. And then, whether they stay on it or not is really depending on everybody's own, background and medical history.
Okay. So you talked earlier about hydration, nutrition, weightlifting. Those things, can they help if you do them in advance? Can they help prevent? And then can they also help support the biostimulators that you would maybe put in order to increase that collagen? So does that also work to help with loose skin, hydration, nutrition, and weightlifting?
Absolutely. So first of all, hydration is at the basis of everything for your skin. Nutrition as well. Eating enough protein, eating enough fruits and vegetables. I always talk about eating the rainbow, like for a reason, right? Like nothing is going to replace that. And whenever you're going to use biostimulators, if you're not nourishing yourself properly, obviously your results are not going to be as great, because at the end of the day, we're stimulating a process where you're creating your own collagen. If you don't have the building blocks to create your collagen, you'll have less of it, right?
I see. So even when you inject a biostimulator, if you're, say, not hydrated, that biostimulator won't be as effective?
If you're not as hydrated, or if you're
nutrient
malnourished, right? If you're nutrient deficient, then the biostimulator won't be as efficient, right?
That's fascinating. I didn't know that.
Because the biostimulator also depends on your capacity of creating collagen. It's not like, right? It's not like a filler or something that's completely independent. It doesn't really matter. It's very predictable, the outcome you're going to have. A biostimulator, the results vary from one individual to the next because of their capacity for creating collagen, and therefore also their hormonal status comes into play because of that as well. Because we know that, estrogen, progesterone, all that have a say in how much collagen you produce as well. So that's why we try to tailor, the protocol to each individual. In terms of muscle mass, that makes a huge difference, because if you're creating muscle, or if you have a good base in terms of muscle mass, that's kind of, replacing the fat in terms of structure. So if you're losing fat and you're building muscle, then you're not going to have as much laxity or as much loose skin, because you have something else acting as a structure for your skin, right?
What about all those facial exercises we see on social media? Should we be doing those then?
Facial exercises? No. Sorry.
Is that a myth?
Yes.
Okay.
Yes. I don't think that the muscle mass will thicken enough to make a difference in the face.
Okay. No. You heard it here first, people. That's so interesting. So actually, we have a whole podcast on biostimulators on the Owning Extraordinary podcast. But for the purposes of this podcast, maybe you can talk about a little bit, what are biostimulators? What do they do? How often you should, how many treatments are typical for specifically in a weight loss patient, if you don't mind?
Absolutely. Actually, what's really interesting is I do work in the research center at Victoria Park, and we created algorithms to treat patients on GLP-1. Those articles were published in order to address the GLP-1 patient in a more correct manner, because it is different than other patients, right? If you talk about biostimulators in general, the frequency and the amount of biostimulators you're going to need for a patient that's not taking a GLP-1 or that's not postmenopausal will be different, right? That's the main or standard protocol, I would say. Now, when we look at patients that are on a GLP-1, the amounts will differ. And obviously, we're going to need more, right? Because we are going through a huge transformation in the body. And fat is not just fat or volume, it's also metabolically active. It has an impact on inflammation, on, and those are part of the process when you create collagen as well, right? When you inject a biostimulator, you are creating a controlled inflammation that tells your fibroblasts in your skin, oh, you need to create collagen, right? So if there's other processes that are going about affecting that, then obviously we need to take that into consideration when we're creating protocols.
Wow.
So I would say for patients on a GLP-1, we need more biostimulators.
Is the technique different too? The application technique or the insertion technique for you guys?
Depending on the effect you want to have with the biostimulator, you will inject it differently, right? And that's not just for GLP-1 patients, but also for, the mass population. But for GLP-1s, if you don't want to add volume, right, because patients are really scared of adding volume to the face, you're going to inject in a matter that will tighten the skin without, adding that volume. So there are patterns of injections and protocols in place for that.
And so you and Dr. Nicholas worked on it. So how long does a research like that take? How long does that, and then what happens to that research after? Where can the layman person, or do you, I think you guys teach other injectors these protocols?
Dr. Nicholas teaches these algorithms internationally at symposiums and conferences. It's the amount of time that takes for each research project is different. So it's hard to say how long it takes for each individual project. It depends on what we're trying to achieve. But at the end of the day, I think we just try to center our research on being able to create protocols that will help advance this field. And I think that the research center saw that there was a gap in knowledge there where that wasn't being addressed because it is a different patient. And every time, as Dr. Nicholas has said, every time you see this patient, it's a new patient.
Because they change every time they come into your office.
He's correct. It's every time you see them, they've changed.
Wow.
So that's why those algorithms were put in place to help, aesthetic physicians address that.
That's fascinating.
Because often when you see a patient, you have a plan for them for, many months or many years, and you kind of follow that plan. You can't do that anymore with this patient, right? You need to reassess them all the time.
Every time they come in.
Yeah.
Is that a difficult conversation to have with the patient? Is that
a difficult conversation? No, I think that if you take the time, they understand that you have their best interest at heart and that you're trying to give them the best possible outcomes.
Yeah.
And I think that once you explain it to them, they understand that we're not trying to do like a cookie cutter approach. We're really trying to target what needs to be targeted at that point in time.
Yeah.
And next time might be different.
Yeah.
Right?
Yeah, I would just imagine people like to know where they're going, when they're going, why they're going, and how they're going. And if that changes for them as well, it might be difficult to grasp to grasp for them. But to your point, if the premise is every time you come in, you're a different client or you're a different patient for me because you've changed so much, I'm sure that once they understand that concept, they understand that the protocol then needs to change.
They do. And when I have the chance of following these patients, not just in aesthetics, but also in the GLP-1 journey, they understand that from the beginning because I tell them, I can't tell you what exactly your treatment will look like next month. It depends on how you respond, even in terms of the medication, right? So it kind of, we integrate that in the aesthetic field as well, where we say every time we're going to give you an overall plan of these are the things we're going to do approximately, so you know where we're going. Obviously, it's a consenting and it's a mutual agreement. But what we're going to do exactly at what time
even you can't tell.
We can't tell because it depends how you're going to lose the weight, where you're going to lose it first,
Yeah.
How are you going to, what's your genetic predisposition in aging, right? Because
Yep.
that has an impact as well. How did your parents age? How do you age? Because your time is not standing still while
Yeah.
you're losing weight as
Yeah.
well, right?
Yeah.
You're still aging.
Right.
And so we need to take that into consideration in our protocol as well, right?
Wow.
So that's why it's hard to tell in advance exactly what we're going to be doing for the next 6 months or in a year from now.
And I think that's a really, really interesting point that you bring up. And there's so much saturation in our industry. There's so many doctors who do this and who do this well. And I love to give people kind of, what questions to ask to know if this person will be, this doctor, if this provider will be a good provider for you in your journey. And I think that's a great question is, do you know the protocol in advance? And if the answer is yes, it's cookie cutter for everybody, that's a telltale sign that maybe they're not experts in the specific GLP-1 weight loss and medical aesthetics journey. So I think that's really interesting for people to take away is asking those questions of your providers to make sure that it's not the same treatment every single time. I think it's important for people to not expect that and if the doctor or if the provider promises you a certain cookie cutter, now that you've listened to this podcast, that's not the right thing.
Absolutely.
Because weight loss journey is different every time they come in.
Absolutely.
If you stay on GLP-1s on a consistent basis, do you need consistent biostimulators?
Well, everybody needs consistent biostimulators because we're all aging and our rate of creation of collagen keeps going down every year. I know it's very depressing, but that's the fact.
Yes,
right?
Thank you.
However, if you're losing weight at the same time, obviously, yes, even more. You're going to need to consistently get biostimulation. Now, the amount will depend on each individual and how much weight and, again, their age and their status in terms of hormones. But yes, I tell them it's a lifetime, it's a long-term relationship. I tell them, right?
Yeah.
Even if you're not on a GLP-1 anymore, like it's a long-term relationship where need to unfortunately continue maintaining. Nothing is forever.
Yeah.
Even facelifts only last 10 years, right? Nothing lasts forever. So we do need to continue. This becomes maintenance. Now, of course, the maintenance, once you're out of the, I would say, acute phase is different, right? You don't need as much once your weight is stable, obviously.
Yeah.
But we still need to keep seeing each other and keep maintaining your collagen production.
Yeah.
Make sure that, we're preventing loss in skin health, elasticity, because time doesn't stop.
What do you tell people when they say, I don't want to start because then I know I can't stop?
You can always stop, right? You have agency. Nobody said you can't stop. It's not going to be worse if you stop.
Okay.
Right? Some people
even with biostimulators.
I mean, biostimulators last 18 to 24 months, right? I tell them, it's an investment, right? You're putting money in the collagen bank.
Yeah.
Right? It's going to keep on working for a good 18 to 24 months.
Yeah.
We keep doing a little boost every year because we want to maintain just when you're starting to decrease your collagen production, we want to boost you a bit, but it's an investment. There's not a lot of things in aesthetics that keep working for 18 to 24 months.
Well, and to your point, we keep getting older. And so if it worked for you 24 months ago, not only do you need to replenish, but also you've aged in the meantime. What about skincare? Is there any skincare that can tighten skin? And I know you can't talk about specific brands, but in terms of ingredients.
So in terms of ingredients, the most important ingredient, I would say, in general is SPF because you're protecting your skin from UV damage because that also has an impact on
collagen.
How well you're going to bounce back after weight loss, right? But then I would say number 2 would be prescription retinol.
Yeah.
Right? That's a tried and true ingredient that will help you regenerate your skin and create collagen. So I would say those are the 2 most important things you need to have in your arsenal, in your toolbox,
But you can't do those alone.
Well, SPF you can, so there's no excuse.
But I mean, like,
but
independently of doing anything else.
Prescription retinol, you need a provider to give you that prescription.
Yeah.
Now there are over-the-counter options.
Yeah.
They are good as well if that's the only thing you can get your hands on.
Are they as effective?
they're not as effective because your body needs to convert it into the active form that you get when you get the prescription medication.
Okay.
But I mean, it still works. And if that's the only thing you can do, that's great. But obviously the prescription strength is more effective.
But those two things wouldn't be enough to create the collagen that a GLP-1
would require.
Yeah.
No. So that's why we offer a multimodal approach, right? We want to treat the skin with skincare, but we're also not just offering injectables, right? Like biostimulators. We're also offering energy-based device treatments such as, ultrasound therapy, radio frequency, microneedling, exactly.
Yeah.
All of those modalities will help in the collagen production in different ways in order to prevent all that excess.
Is there one modality that's more effective than the others in terms of rapid weight loss? Ultrasound, radio frequency, microneedling?
If you ask me what are my top picks, I would say ultrasound therapy is a great one in terms of energy-based devices. Injectables, obviously biostimulation, right? Biostimulators.
And together.
Yes, together it's synergistic. Together it's great.
Kiss.
Yes, chef's kiss. I like that. Yeah, no, definitely. And I really like microneedling as well.
Yeah.
In terms of, helping the surface layer of your skin create more collagen.
And what's great with microneedling is you can do it elsewhere than your face.
Yes, exactly.
So you can do around the belly button, you can do under the arms. So it helps with loose skin on the body as well.
Same with biostimulators, by the way. I don't think we're addressing that enough.
Let's talk about that.
Let's talk about that.
Yeah. So where else can you do biostimulators?
Everywhere. I wish I could bathe myself in it. No, not everywhere, but almost everywhere.
Yeah.
I mean, one common area I treat now with rapid weight loss is the abdomen area, obviously.
Right.
We can treat, around the belly button when you have that loose skin. It helps a lot.
Yeah. And the buttocks?
Oh my God, huge.
Because you get flat bum.
Yes, you do. Absolutely.
Because you lose fat there too.
Yes. Yes, that's one of the biggest concerns actually that I get with a lot of my patients. Like, oh my God, I lost
my bum.
So obviously it's not going to give you back the volume of your bum, right? You need to work out. That's where muscle comes into play, right? Muscle mass comes into play. But in terms of that crepey skin, right?
Yeah.
That loose skin that looks aged now because it doesn't have the fat supporting it. Biostimulation is great in that area.
Yeah.
The neck is a huge factor when you lose fat.
But there's no fat in the neck. Why is that?
Well, there's not a lot. And as soon as you lose that little thin layer, right? Because what we're noticing is that GLP-1s are actually affecting the superficial fat first. So the superficial layer of fat right under your neck, once you lose that, then you get that crepey neck and crepey skin. So a lot of patients are coming in for
neck treatments.
Yes, absolutely.
Wow, fascinating.
Yeah.
Okay. I didn't know that about the superficial skin or superficial fat, excuse me.
Superficial fat.
Yeah. All skin is superficial. Superficial fat. So it attacks the superficial fat
first.
Yeah.
That's also been discussed in the treatment algorithms that we were working on in research.
Okay. So how does that impact the treatment algorithms?
Well, basically in the treatment algorithms, what we try to address is that if we're losing the superficial fat, then we want to create more collagen to tighten that with the biostimulators, but it might be indicated in certain patients to inject filler in a superficial manner with a product that is thin enough to mimic that in order to replace the superficial fat layer.
Yeah, it's really not as straightforward as we would think. It's very complex.
It's complex. It's a complex process if you want to do it right.
Yeah.
It's complex.
Yeah, which is why, I mean, you got to get an expert. It's so important.
You need the support. You need the support in terms of nutrition, in terms of exercise, in terms of psychological support, because it's a big psychological journey as well. And then you need support aesthetically because you're going to have all of these side effects that you might have to handle, and you don't want to have to handle them by yourself. Now, if you're losing a very small amount of weight, sometimes you can get away with it. But as soon as you go over, we were saying that last 10 pounds, you are going to need help.
Yeah. Yeah.
You don't have to do it all alone. You don't have to be, no man's an island.
Yeah. Well, I think what this conversation has really, brought to my attention is just how not straightforward and not typical. This isn't a typical aesthetics journey. This isn't just an aging journey. This isn't just a beautification journey. This is a new world that you as providers are dealing with. Still learning from it. Yeah. Lots has already been learned.
But we're still learning.
We're still learning. You are still learning. I'm still learning too. But we are still learning as an industry. But to have a provider that has done the research is very important, because you're not a typical, or you're not the same patient as you would be if you weren't on a GLP-1. So it's really important.
Absolutely. And that's why I like, marrying research and clinical practice, because it gives me that background and that confidence that when I offer a protocol to a patient, I know it's backed by, research, and it's evidence-based.
Yeah. Yeah. And you're doing the work. Any final thoughts or anything that I haven't asked you that you wish the rapid weight loss community would know about medical aesthetics or a holistic approach that you provide them?
I think that's exactly what I would say. I would say the best weight loss journey is a holistic journey where we can address not just the weight loss, where we integrate all the other factors, and everybody is different. Everybody's unique, and everybody should be treated in that way.
Yeah. And it's not a straight line.
It's not a straight line. I think it's so interesting that we finally have all of these fields colliding, right? Longevity, aesthetics. I mean, I think it just needs the right attention, and it needs the proper discussions so that we can give patients the best outcomes.
Yeah. Dr. Kassandra Oliva works out of our Westmount and Old Montreal clinics. Her handle on Instagram is Dr. Kassandra Oliva, Kassandra with a K, Oliva without a second I, Oliva. So thank you very much for joining me today. I learned a great deal. And you also talk a lot about this on your own Instagram, which I definitely follow. So if you want to learn more, definitely follow Dr. Oliva. And thank you again for being with us. I learned a great deal. Thank you for taking the time to explain everything to us.
Thank you so much for having me.
My pleasure.